And so how do you respond to landlords evicting a health worker just because she has been working with patients who have the disease?
So there is a bottom line in this. And the bottom line is that there is a responsibility of the state, the government, to ensure that such things don't happen. That should not be the first line. It should not be coercion. It should be persuasion. It should be counseling. It should be, but that bottom line should be there. And they should know that, eventually there can be a lot of sweet talk, but eventually the state will act. You cannot take action which is hostile to care providers. But what about persuasion? The need for persuasion and the need for public information is of two types. One I would characterize as just public health information, the science of public health. Just understand that if, say, you're in a neighbor's house or the neighboring flat, you are no more liable to get the disease than anybody else. As long as you don't go touch their door handle or open in and share a cup of tea, or you're sitting within 6 feet, there is no danger. It doesn't pass through the air, pass through the doors and affect you because you are nearer. And therefore, these geographical lockdowns of 5 kilometers around have created a certain understanding that is really wrong. And that it fails to understand the exact modes of transmission of the virus. The second is a cultural fear, which is drawing upon old cultural beliefs of evil and spread of how germs spread. For example, this whole Lakshman Rekha idiom, where there is a magical circle that protects, and outside that circle you are not protected, and this entering the circle. There, I think we need to really come out with another cultural idiom, in some sense of the doctor being a community asset, a guide, that physical distancing reduces risk, never eliminates it. Every one of us, this is a disease that every one of us will get. And the game is about making it as much later as possible, so that by then the vaccine has arrived and so that the hospitals can cope with it. This doctor who is there is your asset, is your passport to access care for your information, and you need him as your friend, you need him as your counselor, and even if those people who are infected and they improve are actually a front line for you.
So what is called for is really to empathize with them for all the good work that they're doing.
Yes, and actively reach out and show support, do things to them that make them feel comfortable and wanted and appreciated on that. Even if you have never talked to that person before, you know that they are going from there, send over sweets on a given day. There's hardly any time they are going to have to take care of, make special things to eat or special things to think. So these things will matter, and they will matter in a big way.
Okay. Thank you so much, Doctor, for this. Thank you.